doctors. Don't forget, Rothman doctors. Rothman has a team for each body part. They're amazing. We love Rothman. They're dedicated to you. And let's welcome our man, Dr. Robert Franks, joins us. Doc, good morning.
Good morning, guys. Thanks for having me.
What a pleasure, Doc. What a pleasure. Hey, Doc, scoot over just a little bit so we see your face. There we go. Perfect. And we get to see your handsome mug.
So, you're Doc, awesome. Thank you.
Today, we're going to talk a little bit about concussions. And which Trevor Lawrence has a concussion. We talk about this all the time, stemming from the NFL all the way down through youth when it comes to football. So let's just talk about it in general. What leads, what of those hits, what leads to the concussion?
So if you think about the brain, right? The brain is kind of sitting like a rose on a stem. So when you get hit, chest or neck, that radiates the head or the head itself, the brain goes back and forth like this and hits the skull from the inside. That's usually what ends up changing the way the brain neurons function at the cellular level, and that's what leads to the symptoms.
How do you tell, by the way? I mean, there's obvious symptoms, but sometimes, we talk about seeing stars, right? Like you talk about that sort of thing. Some of the symptoms that people may not kind of recognize right off the bat that are less obvious, what are those?
Yeah, I mean, visual changes, dizziness, nausea, the lights are on, but no one's home look. Like, you're talking to them and their eyes are everywhere, but on you. Some people have a lot of issues with balance, coordination, and certainly asking them questions, and they just don't respond appropriately. And then everybody knows headache and such.
Yeah. What are some of the long-term effects that a concussion can have on the brain itself?
I mean, the good news is we've gotten a lot better at making a diagnosis, and we've gotten a lot better at treatment. I mean, when I first started, it was everybody rested. I mean, now that's the last thing that we do. So we're looking at really how is your balance? How is your eye movement, neck pain? We look at how social emotional they are, how do they sleep, and how is their brain functioning? And our whole goal is to get all 6 of those things under control. Sometimes we have a harder time doing that. And sometimes people have a pretty big history. Those are the people that when we start doing our treatments and they don't respond, that we start thinking and worrying about the long-term effects. What happens with the long-termers? Well, you saw the hit that we were talking about just a couple seconds ago. But when we worry, we see like somebody gets hit with a lesser hit, symptoms are worse. It takes longer for the patient to get better. We start seeing, we talk about the protocol on NFL Sunday, and we start to see people getting tested in the protocol. We can't get them back to what they were at baseline. So we test them beginning of the season and when they're hurt and as they recover. And if we can't get them back to what they were at their baseline test or at the beginning of the season, then we get more concerned. Yeah, something's going on here, and we're not getting them where they need to be back to what they started.
You always hear about the repeat concussion. Like once you have 1 or 2, you're more susceptible to more. Is there a correlation there?
The statistic everybody grabs is once you have 1, you're 4 to 6 times more likely to get a second. That's the statistic. We're starting to see that change. All right. The issue really becomes is, did you really fix the first one? And is the first one still playing a role in the second one? Or do we have like a truly isolated second one going on at the same time? That it's really looking at these ones that are kind of prolonged. Were they really better to begin with? Or did we not appropriately rehab something, or did we miss something?
It's interesting because you mentioned fixing it. You mentioned the 6 things that you're looking at. How do you attack it? Like, what is the treatment for each of those symptoms?
So when I kind of break it down when I have a patient, whether it's on the sideline or whether, because I've been covering sideline football for like 25 years. So whether it's on the sideline or one of the international events I do, or here, I look at those 6 things. And then it's like, We have testing on the sideline for it. We have testing in the office for it. We have testing and therapy for it. And we're really looking at how do I take those 6 things and how do I give a treatment to the athlete to get them better? Neck pain is going to be physical therapy. Visual issues. We actually have now therapy for vision. And
Wow.
it is almost like PT for the visual processing part of the brain, which is in the back.
Wow.
We've got
That's
physical
fascinating.
therapy. Yeah, I mean, there's a lot going on, and it's very different.
How do
When
you
you and
have
I
PT
played,
for your
yeah,
vision?
we are basically giving them stimuli, and like we'll flash lights in front of them. We'll have them look at different targets, and we're retraining them, just like Dr. Pepe and Dr. Salvo, who you had on the last couple of weeks, just like they're working on retraining knees and shoulders. We're retraining the visual system.
Wow, that's
We work on
fascinating.
retraining their balance and coordination. We start working now very quickly with emotionality because kids within 5 to 10 days, they're stressed out because they've got school they're missing. And at the same time, hey, is someone taking my position? Am I now
Right.
going to be second string? Sleep, we find, makes everything worse if they're not sleeping appropriately. And then, of course, we're always testing how is the brain doing? How is their visual memory? How is their verbal memory? How is the recall? Are they doing things as quickly as they could before? And this is especially critical in the college and high school kids because the same things that make the NFL guys symptomatic is worse because what are they using all the time? Smart boards, iPads. And that's where the kids have their downfall because that visual issue, their inability to focus, becomes even more challenging for them. So they're getting attacked 2 ways. They can't play football and they're having a hard time in the classroom.
Wow. That's fascinating. It's so interesting. It's really interesting in the developments that you guys are making in, healing it, like and helping thwart the long-term effects from the concussions.
Oh yeah, it's changed a lot. We just published internationally another consensus statement on concussion. The United States itself has done a couple, 1 or 2 of which I participated in, and we've really advanced. And I was in the second paper and now the third paper for the team physicians consensus statement. And just to watch how we've evolved from just between those things where it was kind of like, guy comes in, okay, you're a complete rest. No school, stay home,
Right.
no exercise. Now, if you come in the office and you're looking half decent, you're exercising within 24 hours. We are trying to not do school accommodations if you're doing okay. And parents come in and it's like, oh my God, this is completely different than what we're used to hearing. And it kind of got buried in COVID. But yeah, we are very aggressive now. If you can, actually half decently do a physical exam in the office, symptoms are under control, we'll start to push you. We'll get you on the bike. And if your headache is a 4, we'll kind of let you go to a 6 and then pull you back a little bit. No different than, Dr. Pepe and Dr. Salvo. They're going to get their toe down first to start them walking again, then get their toes down, then their foot down. And that's how you advance the patient. So it's really active engagement now.
That's fast. That's so fast. Listen, I have 2 kids that are athletes, and they both play football. And so as a parent, it's just amazing to hear. And just as a steward of the sport of football, I love hearing that. Doc, God bless you guys, man. I always talk about Rothman and what you guys do when it comes to participating in these groundbreaking studies. It's amazing, man. Thank you.
No, I appreciate it. And I appreciate you giving me the opportunity to do this because it gives a chance for like parents and the athletes to go, okay,
Yes.
there's something for me to do and I have more control and it's going to make me feel better. And it's not just sitting there because athletes don't do well sitting. And quite honestly, neither do parents. So giving
Yes.
them something to look at and a goal has completely changed things.
That's awesome. That's fantastic. Doc, listen, have a happy and blessed holiday season. Thank you
Same to
so
you guys.
much.
It was a
You're
pleasure.
fantastic.
Thank you so much. I really appreciate the opportunity. You guys have a great holiday as well.
You too, buddy. What a pleasure, man. Dr. Franks,